So that's why, like, it's an unofficial third rule of anatomical naming, but it is something you kind of get 2 for 1. That's what I'm getting at here. Sometimes it saves you. It's a little shortcut that can help you make a best guess at where a muscle is, even if you've never seen the muscle before. So the thing is that and this is where knowing all those terms that I love so much pays off. If you're taking them seriously, then you're already a few steps ahead. Now you have a vocabulary to kind of like, okay, is there a lot of words in this muscle's name? Hey, maybe I can get a lot of information from that name without even seeing the muscle itself. Then when you're thrown into an anatomy exam, you kind of know where to look. You kind of know what movement to look for or what directions to look for as well. And we are running out of time. So the thing is, like, do I have more top hat questions? Actually, let's end with like click on target questions. Let's just finish on some of those fun labeling questions at the end. All right, so click on the yellow square highlighting the external oblique muscle. Hey, we just talked about that, right? Again, external meaning outside, but what does oblique mean? Okay, let's see how everyone did. And again, you have to, for these questions, click on the yellow square. So yes, you are correct, the people who clicked over there. But yeah, most of you who clicked there are correct. Again, the external oblique, when that oblique meaning a slant. So yes, you are clicking on the external oblique, but to get the right answer in this click on target, you have to click on the square. So all right, next question. Now click on the yellow square highlighting the brachioradialis. Okay, lock in your answers, and let's see how everyone did. So most of you clicked here, some of you clicked over here, some of you clicked here, and the people who clicked, let's reveal the answer here. Yeah, so the people who clicked here are correct. So brachioradialis, this is the brachialis over here. So the brachioradialis actually runs from the brachium, your arm, and remember your radius, this is the more lateral of your forearm bones. So it's running from the brachial, or the brachial part, your arm, and running down the radius. So that is the brachioradialis. This is the brachialis over here. And next question. Click on the yellow square highlighting the Sartorius. Now we didn't cover this in this lecture, but it is on that list of muscles. And actually that previous question was kind of on the harder side, because this is why not only should you know how to label it on this picture, but also on the zoomed in version. Because again, something like the brachioradialis, if I'm showing you the whole body, it's going to be a very thin muscle. So I'd rather give you a more zoomed in target where you can see it more clearly than just having you test on just these 4 pictures. Okay, Sartorius. So which yellow square is placed on one of the Sartorius muscles? Okay, so yeah, many leg muscles, but this one is, oh yeah, most of you got it correct. So this is the Sartorius muscle over there. And this is a classic giveaway. Not only is it superficial, but it kind of goes at a slant. So when you're kind of rotating the leg, this is one of the muscles that aid in the rotation. And then Tibialis Anterior. Let's end on the really... So Tibialis Anterior, notice that, hey, it has a bone in the name, and it also has an anatomical direction. So hopefully this helps you answer that. Again, this is why people think sometimes they're scared when I say, hey, you gotta memorize all the bones. But if you know all the bones, then when you have a muscle like this, it allows you to zoom in where that bone is. Hey, where's the tibia? And where's anterior? So the thing is that, hey, this muscle must be anterior to the tibia, right? Now let's give it a little more time. I think some people are trying to lock in answers. And yes, I love it when it's systematic. I wish all muscles and joints and anatomy was systematic. Unfortunately, that's not the case, but I mean, if you know the systematic names, you can knock off a bunch of the muscles. It helps on studying. That's why I'm trying to kind of like give you all these terms over the time so that it kind of builds up your vocabulary. So we are out of time, and so I'll see you all on Monday. That is the final full lecture. I will try to... Oh, sorry. So here it is. Yep. So here we go. So that's what we have here. Notice that this is the tibia. This is the one that's anterior. This one right here, this is the soleus. It's actually behind the tibia. This is toward the posterior. So yeah, the tibialis anterior, this is where all that knowledge of anatomical directions, all the knowledge of bones, if you already memorized them. And again, if you haven't memorized your bones and know where they are, this is a big signal. Hey, I have to know this, or I mean, now if you're trying to do this all like Thursday before the exam, oh my God, you're gonna be treading water. But thing is that if you haven't known if you don't know your bones yet, this is a big reason why you should start knowing your bones. Yep. Yep. So again, so I will try to upload Sunday at the least. Review guide will be uploaded on Sunday at the least. Sorry, this week was kind of nuts, but and stretch goal by Saturday, the end of Saturday, but at least by Sunday. So the review guide is coming. It will help narrow down the amount of images you have to look at. And the thing is, what else will it have? Yeah, the list of topics and yeah. So this is what, but again, it's more, especially the ones I cover in lecture. The images I have, I think they're chosen also for a reason. They're curated for a reason. So also focus on those as well. But again, if you haven't gone to the resources folder and looked at the anatomy images and looked at all the resources, I'm not just trying to throw hundreds of slides at you, but if you notice, yes, the Martini images are a slight click better than the OpenStax images because they have better contrast, more delineation between muscles. So they're there to help. Again, do not make the mistake of just studying those 4 general whole body images. I will zoom in, but not to make things difficult, but make it easier for you to identify. That's the whole purpose of it. All right. Okay, so see everybody on Monday, rest up, and I guess my homework is to get that review guide up for you, all of y'all, okay? All right, so see you on Monday. Take care, stay healthy, and see you next week, all right?